Every 66 seconds, somewhere in this country, another older adult hears the word dementia. By the time this video comes to an end, 20 more families will have received that news, and for a portion of those families, the answer was never their age. It was a bottle on the bathroom shelf, one they were told was perfectly safe. I'm Dr. Andrew Bennett. After 15 years in clinical practice, I've watched this same sequence unfold more times than I can count. Someone who spent their whole life with a sharp mind begins to lose track of things. Names, appointments, the way home they've traveled 10,000 times. The people around them nod and call it aging. It wasn't aging, it was a medication. One that almost no one stops to question because a doctor wrote the order and a certified pharmacist filled it. What the most recent research keeps confirming is this: an ordinary, widely used category of drugs can drag your memory and your learning capacity down drastically in a single year, and most people taking them have no idea the damage is accumulating. Today, I'll walk you through the 9 medications most consistently linked to rapid cognitive loss. We'll count down in reverse from the ones that go unnoticed to the one I consider the most destructive on the list. Pay close attention when we reach number 3. It's in the hands of millions of older adults right now. Prescribed for something that sounds completely benign, and it could be silently shrinking the memory centers of the brain without a single obvious warning. Before we begin, leave a comment telling me your age and what medications you take every day. I read what you write, and the age of this audience determines where I'll go next. Let's start with number 9, and don't be fooled by its position, because this one sits in nearly every medicine cabinet in the United States. Diphenhydramine. Number 9 is diphenhydramine. You recognize it by its over-the-counter brand name, Benadryl. It's the little pink tablet people reach for when they can't sleep, when allergies flare up, or when a cold needs something to ease the symptoms. It costs a few dollars. It sits on an open shelf. And because it doesn't require a prescription, most people assume it must be gentle on the body. Inside your brain, it's doing something far more significant. Benadryl belongs to a category of drugs called anticholinergics. That's a technical term for a straightforward concept. These medications block a brain chemical called acetylcholine, the very messenger your brain depends on to form new memories and to stay alert and engaged throughout the day. As the years go by, the brain naturally produces less of it and relies more on what remains. So a drug that blocks acetylcholine hits a 70-year-old brain much harder than a 30-year-old one. The region that absorbs the impact is the hippocampus, the little seahorse-shaped structure responsible for building new memories before they're stored permanently. In my practice, I've seen patients take a nightly antihistamine for years and gradually lose their cognitive sharpness, never establishing a connection between the mental fog and the pink tablet sitting next to their bed. The research establishes that connection clearly. A 2023 article in the Journal of Geriatric Cognitive Health followed older adults who regularly used anticholinergic drugs and found a 54% higher risk of developing dementia compared to those who avoided them entirely. More than half the baseline risk added on top for something most people treat as harmless. Here's the practical step. Read the label of anything you take to help you sleep and anything marked PM, nighttime, or allergy relief, because those products are in many cases simply diphenhydramine under a different brand name. If allergies are the reason you're taking it, newer antihistamines like loratadine, sold as Claritin, don't penetrate the brain the way diphenhydramine does, and they are substantially safer long-term. Never stop a medication on your own. Talk to your doctor first, but stop assuming that a shelf product means a product safe for your memory. That's number 9. Proton pump inhibitors. Number 8 is one your stomach may thank while your brain silently absorbs the cost. Number 8 is proton pump inhibitors. The most familiar names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications suppress acid production in the stomach and are routinely prescribed for heartburn, reflux, and that burning sensation that follows meals. People stay on them for years, sometimes decades, because the moment they try to stop, the symptoms return with force. The drug feels like the only thing keeping things under control, so they keep taking it. Here's what almost no one hears at the pharmacy counter. Your stomach requires acid to extract certain nutrients from the food you eat. Most critical among them is vitamin B12, which maintains the integrity of your nerve fibers and your brain. Suppress that acid long enough and hard enough, and your B12 levels will quietly drop. So will magnesium and calcium, 2 minerals your neurons depend on to fire and communicate accurately. Cut those neurons off from their essential inputs, and it produces failures, cognitive confusion, and memory errors that look exactly like the earliest stage of Alzheimer's disease, when the real cause is a nutrient the medication has been cutting off the whole time. In 2016, a large study published in JAMA Neurology examined more than 73,000 people aged 75 or older. Regular users of these inhibitors faced a 44% higher risk of dementia than those who didn't take them. And the problem goes deeper than nutrient deficiency alone, because these drugs have also been shown to elevate beta amyloid levels in the brain, the sticky protein that accumulates in Alzheimer's disease. So here's the step to take. If you're taking one of these drugs every day without question, that's the conversation to bring up at your next appointment. Many people can transition to a gentler class of drug called H2 blockers. Famotidine, sold as Pepcid, carries a much lower risk of affecting cognitive function. Deglycyrrhizinated licorice, a natural compound that soothes and protects the stomach lining, can reduce symptoms without charging the brain a bill. The goal is the lowest dose for the shortest time necessary, not a pill taken indefinitely out of routine. Number 7, bladder medications. Number 7 is prescribed for a problem most people would rather not mention. Number 7 is bladder medications, and the name to know is oxybutynin, sold as Ditropan. It's given to older adults who struggle with the sudden, urgent need to reach the bathroom. The kind of overactive bladder that can derail an entire day. The relief it provides is real. The embarrassment it saves people is real, but oxybutynin works by blocking acetylcholine, the same critical memory chemical that Benadryl blocks. And this one crosses into the brain very easily and settles precisely in the areas where memories are built. That makes it one of the most dangerous entries on this list for an older adult, particularly when taken month after month, year after year. In 2019, the British Medical Journal published a study of adults over 65 who used potent anticholinergic medications like oxybutynin for more than a year. Their dementia risk was 49% higher, nearly 1 in 2. And what worries me most is this. Almost none of them were warned. They were told a pill would help with urinary urgency. Nobody mentioned that it could be shutting down their mind at the same time. The cognitive decline gets attributed to getting older. People describe forgetting appointments, losing their keys 10 times in a single day, losing the thread of a simple conversation halfway through. The people around them nod sympathetically and say, "Well, you're getting older." It almost never gets traced back to the prescription until real cognitive ground has already been lost. If you're taking oxybutynin and you've noticed your memory slipping, take that observation seriously because you don't have to choose between your bladder and your brain. A newer medication, mirabegron, sold as Mirabetrip, operates through a completely different mechanism and doesn't touch the acetylcholine system at all. For most older adults, it offers comparable control with much less risk to thinking and memory. Bring it up at your next visit. Number 6, statins. Number 6 may be the most unexpected on this list because it's among the most prescribed drugs on the planet. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medications in the world, especially after age 60. They serve a genuine purpose, lowering cholesterol and reducing the risk of heart attacks and strokes. Statins have a place in many people's lives, and this is not an argument against them. What follows is the part of the story that usually gets left out. Cholesterol does far more than affect your cardiovascular system. Your brain is nearly 60% fat and depends on cholesterol to build the myelin sheath, the protective insulation that wraps every nerve fiber so signals travel quickly and cleanly. If you lower cholesterol drastically with a strong enough statin, you can leave the brain without a raw material it actually requires. The statins that create the most difficulty are those that penetrate brain tissue most easily. In 2023, a study published in Frontiers in Aging Neuroscience found that adults over 70 who had taken statins for more than 3 years showed a 26% higher rate of mild cognitive impairment, and the higher the dose, the greater the decline. Some patients describe alarming episodes, a familiar name that simply vanishes, a conversation that ended moments earlier completely erased, a route driven without incident for 20 years that suddenly becomes unrecognizable. What's important to understand is that not all statins affect the brain equally. Pravastatin and rosuvastatin don't cross into brain tissue as easily and are generally considered safer options when preserving cognitive function is a priority. So if you've been taking a statin for years and mental fog, forgetfulness, or confusion have gradually increased, that's a real and legitimate conversation to have with your doctor about a lower dose or a switch to a more brain-friendly alternative. It's not a reason to stop a medication that may be protecting your heart on your own. Set the right plan with professional guidance, never unilaterally. A quick pause here. If this is helping you connect dots you never had the chance to connect before, take a second and hit the like button. It really helps this information reach more older adults who need it. And while you're there, leave a comment telling me how many prescriptions you're currently taking. I read every one of them. All right, back to the countdown. Number 5, benzodiazepines. Number 5 is benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most prescribed drugs in the United States for anxiety and sleep difficulty. They work by amplifying GABA, the brain's own calming signal, the mechanism that quiets an overactive nervous system. At first, they can feel like a lifeline. Panic recedes, racing thoughts begin to slow, sleep finally comes. But over time, the picture changes in ways people rarely anticipate. A 2022 study published in the British Medical Journal followed more than 8,000 older adults over 6 years and found that those who used benzodiazepines for more than 3 months had a 51% higher risk of developing Alzheimer's disease. Longer-acting drugs, diazepam in particular, appear even more problematic because they remain in the body longer and accumulate in fatty tissue, including the brain itself. What these medications produce over time is a slow chemical suppression of the whole brain. Learning slows, mental flexibility erodes. Many people describe a general emotional flatness, the sense of moving through fog and no longer quite recognizing themselves. The cruelest element is the exit. Stopping a benzodiazepine abruptly usually causes anxiety and insomnia to return with even greater intensity, often accompanied by agitation that can become genuinely dangerous. That makes the medication feel absolutely necessary at the very moment when it may be causing the most harm. So here's the rule, and it's one that matters enormously. If you've been taking a benzodiazepine for more than a few weeks, don't stop it abruptly, because doing so can put your life at risk. Taper the dose gradually under your doctor's supervision over weeks or even months. There are gentler paths. Buspirone can treat anxiety without producing sedation or cognitive dulling, and there are specialized therapeutic approaches designed specifically for insomnia and anxiety that can restore calm without charging the thinking brain a bill. Number 4, amitriptyline. Let's move now to number 4. Number 4 is a single drug prescribed for 3 distinct conditions, and it carries one of the heaviest hidden burdens on this entire list. Number 4 is amitriptyline, sold as Elavil. It's an old generation antidepressant that's still widely prescribed today for neuropathic pain, sleep difficulty, and even migraine prevention. That flexibility across different conditions is precisely what made it so widely used. It looks like a medication that can handle almost anything. Beneath the surface, it's one of the most potent anticholinergic drugs still in common circulation. That means it suppresses acetylcholine, the very chemical your neurons depend on to signal each other and encode new memories, with exceptional force. It blocks that system so aggressively that with long-term use, memory problems stop being an occasional side effect and start looking like a predictable outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 or older, those with the highest cumulative exposure to anticholinergic drugs, with amitriptyline as the protagonist, over a 10-year period faced a 54% higher risk of developing dementia, and almost none of them were ever told the medication was capable of that. It was given for sleep, for pain, and then gradually the words began to disappear. Memory got thinner, concentration weakened, and they simply concluded it was part of aging. It doesn't even require a large dose. A modest nighttime amount taken over years can steadily erode cognitive function without any dramatic warning signal until the loss becomes significant enough for someone to finally notice. If you or a loved one is taking amitriptyline, that's a conversation worth starting soon. For neuropathic pain, medications like duloxetine or gabapentin can provide comparable relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this pathway, can serve as alternatives. And for mood, newer antidepressants like sertraline or acetylcholine are generally considered much safer for long-term brain health. Number 3, paroxetine. Number 3 is the one I flagged at the beginning, the one prescribed to millions of people for something that sounds completely harmless. Number 3 is paroxetine, sold as Paxil. It's one of the most widely used members of a family of drugs called SSRIs, prescribed for both depression and anxiety. On the surface, it looks like a modern, moderate option, much gentler than many of the old psychiatric medications that preceded it. Here's the detail that rarely surfaces in those conversations. Paroxetine is the only SSRI that possesses significant anticholinergic activity. That unique feature sets it apart from closely related medications like sertraline or escitalopram because it acts on the same acetylcholine system that all the other drugs on this list have been undermining. A modern-looking medication that does something far older and more damaging underneath. In 2021, a large review published in Frontiers in Psychiatry examined older adults taking various SSRIs and found that paroxetine users showed measurable declines in short-term memory, word retrieval, and sustained attention within the first 12 months. Older adults taking paroxetine were 30% more likely to show early markers of cognitive impairment compared to those taking other antidepressants. There's a painful irony buried in that finding. The medication exists to stabilize the mind, to restore some degree of clarity and stability, and over time it may be wearing down the very mental clarity it was supposed to protect. The path forward here is clear. In older adults, paroxetine is generally a medication worth replacing when alternatives are available. The American Geriatric Society included it on the Beers list, a formal catalog of medications considered potentially inappropriate for older adults precisely for these reasons. If you take it, ask your doctor about transitioning to a safer SSRI like sertraline or escitalopram, which don't carry the same cognitive concerns. Supporting healthy B vitamin levels, particularly B12 and B6, can also help sustain mood while those changes are being made. Number 2, antipsychotics. Number 2 is prescribed so quietly that many of the people currently taking it never understood what kind of medication they were accepting. Number 2 is antipsychotic medications, and this one worries me at a level beyond most of what I've discussed today, because many people taking these drugs never consciously consented to an antipsychotic. The names quetiapine, sold as Seroquel, risperidone, sold as Risperdal, olanzapine, sold as Zyprexa. These medications were developed and approved for serious psychiatric illnesses, schizophrenia, bipolar disorder. Today they are frequently prescribed off-label to older adults for sleep problems, mild restlessness, or behavioral agitation related to dementia. Powerful medications designed for severe psychiatric conditions are now being routinely used in private homes and care facilities for older adults who are simply confused, restless, or difficult to manage when the caregiver is overwhelmed. The cost can be severe. In 2022, a study published in The Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a single year, even when they had no prior history of dementia before treatment. These medications also increase the risk of stroke, sudden cardiac death, and the profound sedation that contributes directly to falls and hospitalizations. They work by suppressing dopamine, a chemical involved not only in mood, but in focus, planning, and memory. If you reduce dopamine enough, the brain becomes slower, less responsive, less present. Some people taking these medications appear switched off, emotionally absent. Families mourn a disappearance while the person is still physically there. If you or someone you care for is taking one of these medications, the first step is to ask the prescribing doctor a direct question. Why was this started? And is it genuinely necessary, or is it being used primarily for behavioral management? Many behavioral symptoms can often be addressed without any medication at all through predictable daily structure, reducing sensory overstimulation, treating undetected pain, and better support around sleep and lighting. When medication is truly necessary, the lowest effective dose for the shortest justifiable duration helps limit the harm. Too often, families are never told what these medications are capable of doing to the brain. They watch a decline they attribute to natural aging when the real engine may be chemical and correctable. Number 1. Anticholinergic polypharmacy. Now we arrive at number 1. Number 1 is not a single medication and may be the most important hidden engine behind every case I've described today. Number 1 is anticholinergic polypharmacy. It's the risk almost no one talks about, and it may be one of the leading causes of medication-induced memory loss in older adults living today. You were probably expecting a final villain, one last pill, the worst of all. The reality is more subtle and, in a certain way, more alarming. The greatest danger often arises from the gradual accumulation of multiple anticholinergic drugs taken simultaneously, while no one calculates the total burden. Polypharmacy means taking many medications at once. Anticholinergic burden is the term for the combined effect of those medications blocking the same critical memory chemical at the same time. Picture a scenario that happens constantly. An older adult takes Benadryl every night for sleep, oxybutynin every day for urinary urgency, amitriptyline every night for neuropathic pain. Taken individually, each may produce only a barely perceptible effect. Taken together, those effects multiply, and the burden on the brain rises drastically. In 2022, a study published in Age and Aging followed more than 280,000 older adults and found that those carrying the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk. And the vast majority of them had no idea they were taking anticholinergic medications at all. No one had explained it to them. No one had connected the dots between the prescriptions. When acetylcholine is blocked simultaneously from multiple directions, the brain doesn't just slow down. The neurons themselves can begin to weaken from disuse. The connections can shrink. The brain can drift into a quiet, low-energy state that is nearly indistinguishable from Alzheimer's disease when measured on a cognitive test. This is the reason I made this video, and it's hopeful. Medication-induced cognitive decline is frequently reversible when caught early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is more resilient than most people have been told, but only when the source of the damage is actually removed. The solution doesn't require any miracle. It requires a careful, systematic medication review. Sit down with your doctor or your pharmacist. Lay out every prescription, every over-the-counter product, and every supplement you take on a given day. Calculate the total anticholinergic burden. Simple scoring tools exist to help measure that risk. Once problematic drugs are identified, the unnecessary ones can be reduced or discontinued under proper medical supervision. Safer alternatives can be introduced, and the brain can be given a genuine chance to recover. This is probably the most preventable threat to the aging brain on this entire list, and that is precisely why it holds the #1 position. Now I want to hear from you. Of these 9 medications, which ones are currently in your medicine cabinet? Have you noticed mental fog or progressive memory loss after starting a new prescription? Write it in the comments below and tell me which one you'll be requesting a medication review for this week. Your answer may be exactly what the next person who reads it needs to hear. Before you go, there's one more place where your body stores its signals. Your medicine cabinet is one place, your hands are another. Your nails can show warning signs related to your kidneys, your blood, and your nervous system years before anything else appears. Most people never learn what to look for. That's the topic of the next video. I'll show you the 4 signs on the nails worth examining tonight. I'm Dr. Andrew Bennett. Stay sharp, and I'll see you there.